Hello and welcome to Humanize the Hustle. Here we believe that health and happiness is non-negotiable. Hey, welcome back to Humanize the Hustle. By now, you know that I am deeply passionate about exploring and driving awareness about alternative therapies that open new doors for healing and transformation. Today, I'm excited to be diving into a topic that is revolutionizing the way we approach mental health, well-being, and trauma recovery, ketamine therapy. Many have heard of it, but few truly understand the profound impact it can have. That's why I'm honored to be joined by Amanda Edwards, a licensed clinical social worker with over 2 decades of experience in fields like domestic violence support, substance abuse recovery, family services, and hospice care. With training from the Psychedelic Research and Training Institute, she combines the wisdom of traditional therapy with cutting-edge world of psychedelic-assisted healing. Amanda's unique approach integrates the power of breath, movement, and embodiment practices, allowing people to reconnect with their bodies and access the deeper layers of healing that we all need. Her beautiful healing containers include holistic support that combines doctor-supported journey work and therapeutic integration. Today, she's here to illuminate why ketamine, a legal and highly effective tool, is becoming the go-to entry point for those ready to explore the transformative potential of psychedelics. This conversation is more than just a treatment. It's about opening ourselves to new possibilities, embracing breakthroughs in mental health, and finding a path to true inner healing. So if you've been searching for answers or simply seeking inspiration on your journey to wellness, get ready. This episode is for you. Welcome, Amanda.
Thank you so much.
I'm so excited you're here. And this has been something that I've heard a lot about. I've actually never tried ketamine therapy, so this is going to be a lot of learning for me too. I've heard a lot about it, but it's so exciting to have an expert on and be able to pick your brain and have you share what a great therapeutic approach this is. So maybe you can start by just explaining a little bit of your background, a little bit of how you got into it, and set the stage for the discussion today.
Absolutely. So I have my master's in social work, and I am now a licensed clinical social worker, which is the license that many traditional talk therapists have, though I've never had a traditional talk therapy practice. I worked in hospice for about a decade as just someone who has a master's in social work, not using the more clinical approach like we think about it in terms of like traditional talk therapy. But took my time, got my license, and kind of found psychedelics myself late in life and also professionally. That it kind of sprouted from my own personal exploration with psychedelics. Where to begin? So my training with the Psychedelic Research and Training Institute in Colorado, that was specific to ketamine-assisted therapy, was in 2020, but I had already been sitting with other medicines for several years at that point. And I didn't even know that we were working with ketamine in therapy when I started getting emails from the Psychedelic Research and Training Institute. We call it PTSD. I still to this day have no idea how I got on their mailing list. Totally just serendipitous. And decided to sign up for the course. At that point, it was 6 months after shelter in place in 2020. So we were still all locked in our homes, not really communicating, not really in contact. And what this email said from Prati was that this isolation is keeping us sick. And we need to come together and be together and heal as a community and as a society and use what we know about harm reduction. And so even just their approach to that, I had no idea about ketamine-assisted therapy, but I was in. I was sold on whatever you're training me on. I'm ready to go. And because it is legal and because you do need a doctor and DEA licenses and various, the infrastructure and the framework for this type of therapy, I didn't have any of those other things, and I wasn't seeking the training out in order to do this work. And so it was almost a year. It was 11 months before I got an email from a doctor here in town who had also completed the training through Prati. We were both part of the alumni network, and he had completed the training and just said, I'm in Santa Cruz. Is there anyone else around? And so I responded to him, and we clicked right away, and it just almost seamlessly we're able to start working together.
So you by practice are a clinical social worker, and then so you were working with domestic violence, like in the intro I was saying, and you were working in hospice, and then you yourself had sat and done some journey work on your own. So before you went and did the ketamine training.
Correct. Not with ketamine.
Not with ketamine.
I had never used ketamine personally. I had never used ketamine professionally. I had never sat for ketamine at all. So what I loved about Prati, another of the selling points for me, was that it was an experiential training. It's not just reading books and reading research, but we actually got the opportunity to journey both as a client, as the journeyer, and then also sit for others in our cohort. So we got actual experience sitting. Now, ketamine is in a class all of its own. It's a dissociative anesthetic. And so I had never sat for any type of medicine like this. But it's, I would say, similar skills in terms of being the person kind of holding that container for the journeyer.
Yeah. And so when you did your training, was that virtual?
No, it was in person.
So during COVID, you were able to go to Colorado and do it. That's super cool. It's a good way to kind of get out of the lockdown.
Well, that's what I mean. I mean, the fact that they were sending this email saying, we're going to come together and practice outside, and we'll do what we need to do in order to really, really come together and have our nervous systems in the same room, or in the same, at least, area again.
Yeah.
Because we were just at that point so isolated, and we didn't know how long it was going to be that way. This is back when people were still wiping down their groceries, and you know what I mean? Everyone was online at school and at work. And so just the fact that this organization, who also, by the way, continues to be a clinical testing site for the MAPS clinical trials. Okay. So a reputable, vetted organization coming forward and saying, like, we need to be working together. We need to be coming together. And so that's what really drew me.
Yeah.
Not so much the ketamine therapy. That was interesting to me. But I just loved their whole approach.
Yeah. So ketamine is part of the umbrella of psychedelics, right? So is that true?
Not traditionally. So it's a medicine that's legal. It's on the World Health Organization's list of top 10 essential medications. It's used all over the world. It has a very safe medical profile. It's used for everything from like local anesthesia to someone could get it in an IV or in an epidural, and it's like general anesthesia also. But it's not, we give it at a psychedelic dose, but like when it was being formulated, when it was being designed, and how it's typically prescribed is not for psychedelics.
And so what's the history on that? Like, who came up with this idea that taking these at a larger dosage can help restructure the mind, I guess, and maybe even talk a little bit about that when you're talking about it. So how does it work, and how does it help, and what does it help maybe?
Yeah. And actually it's a smaller dose than how we're typically using it.
Oh, okay.
So that's the interesting part, and part of how we kind of followed the thread to start studying it for mental health after Vietnam. The VA or whomever is in charge of kind of keeping track of the veterans and the soldiers who are in battle somehow put together. Well, okay, let me back up. So the medics in Vietnam had ketamine as an anesthetic for men who were injured in battle. And so a medic or even a soldier would have a shot in their like kit and be able to give someone who was injured this immediate pain relief and get them to safety. After Vietnam, when those guys came home, somehow it was put together that there was this subset of soldiers who were having markedly lower rates of trauma. PTSD wasn't a thing yet, but what we would now call PTSD, there was this group of soldiers who was having markedly lower instances of these trauma symptoms. And they somehow put together that they were the guys who had gotten ketamine on the battlefield.
Okay.
And so they started piecing together, like, how is this working that these soldiers somehow are having lower symptoms of trauma? And what they kind of put together was that as a dissociative anesthetic, there's a part of our brains that kind of shut off and we kind of go somewhere else depending on the dosage.
And that's the dissociative. When you call it a dissociative anesthetic, that's the dissociative part.
Exactly. So whether or not those guys were having psychedelic experiences, we don't know, but they were dissociated at the point of trauma or shortly thereafter. And so maybe the trauma didn't get stuck in their brains in the same kind of way or stuck in their body. What we know now about energy and trauma and how it's kind of on a loop in our systems. And I can get back to that later and talk about how this kind of opens that channel and lets that stuck energy move through in a different kind of way. And there's something magical about the dissociation that allows that to happen. That is it a different kind of way than the more traditional psychedelics, which are like psilocybin, LSD, ayahuasca, mescaline, and so forth.
Yeah. And so who is this approach best for? Like, who is really seeing a lot of improvements and relief? And I think most of it's for mental health, right?
Mostly mental health, absolutely. I mean, we see everyone from treatment-resistant depression, anxiety. That's mostly what it's being studied for now. PTSD, certainly, but it's also being studied to treat depression. Addiction. We see folks who have eating disorders or other self-harm behaviors. We see folks who have OCD. I mean, we haven't ever seen anyone. We've had over 200 clients.
And this is in your practice?
Just in our practice alone. Who hasn't said this helped me in some way.
I'm better now than I was when I first came in.
And it's not always in the way that we anticipate, because of the way that our brain works and we kind of get attached to certain ideas. And we're a very kind of diagnosis and kind of treatment-driven society, the Western medical system. And so I think, people come in like, I'm this, I'm depressed, I'm anxious. It becomes an identity almost, which is an aside. But we are using those executive functioning parts of our brain when we try to understand what's going on with us and what we have access to. And, sometimes when we get into that psychedelic space, we discover something that we didn't even know was there. Or, it's been operating so consistently and covertly that it's like, I could tell you about my first journey was all about the absence of fear, which I didn't even know fear was playing a role in my life.
Yeah.
I consider myself pretty brave, and I'm taking risks and I'm exploring and I'm a seeker and all these things. But during my very first journey, which was in Colorado at the training, the whole journey was of the experience of being without fear. So I would have no way of knowing in my intention setting and my sitting across from my, clinical sitter to even say, I'm going after this idea of fear because I didn't even know it was there until I went into the journey and experienced the absence of it.
And so when I've done MDMA therapy, and I know that when I went in and did that journey, I went in with my intentions, and you kind of release everything, go through the journey, and then whatever comes up. And for me, one of the things was with my mom, I was really angry at my mom after she passed away, and I really did not want to be angry with her anymore. And during my journey, I felt like head to toe compassion, like cellular compassion for my mom, and where I wasn't able to access that before I went into my journey. Afterwards, I really felt like once I felt it and I acknowledged it, I'm like, okay, it was there. Was that the same thing with fear? Like, you didn't know that like fear was a blocker for you, and then you're like, oh, this is something that's an issue, and you work through it. So maybe talk a little bit about that for yourself.
Yeah, so that kind of speaks to the integration of, I had this experience, and the irony is it's kind of this somatic experience that you have, even though you're dissociated from your body. Yeah. But, it's in therapy, in traditional talk therapy, we're kind of working towards this like conceptual idea of how we want to feel or how it might be. And with psychedelic medicine, we get the somatic experience of it. And so then I think of it as like, okay, now I've secured this perimeter. I have this bubble now where I know what this feels like, the cellular compassion or the being without fear. Now integration, I get to try and hold that perimeter, try and keep the bubble inflated. How do I hold on to the somatic experience? And it's like I can feel it now when it's creeping back in. Do you know what I mean?
Yeah.
So I have this alternate experience now that I want to try and protect, and I want to try and keep my body and my nervous system and my mind and my psyche in this space as much as I can. And so the integration is very literally, how do we integrate these practices into everyday life so that I can keep myself in this bubble as often as I can?
Yeah. And so ketamine is legal, meaning that anybody, so you have to be certified, you have to be working with a doctor. Like, how does that setup work?
So it depends on the way that ketamine is being used. So the way that we at Innate use it is intramuscularly. We do a small dose, a small sublingual dose to kind of what we call like get on the runway, to kind of get the body accustomed to the medicine a little bit. And it also adds to the overall dosage. And a client will hold the medicine in their mouth for 12 minutes, swish it around to get kind of maximal surface area in the mouth, the transmucosal absorption there. After 12 minutes, they spit the medicine out, they rinse their mouth, and then we do the intramuscular injection. So I'm not a medical licensed person in any way. And so I never touch the medicine. I don't, the doctor that I work with prescribes it. He administers it. I am there. I'm present for all of the sessions. And the client never has possession of the medicine.
And that's the standardized, legal approach. Would you, right? And I'm sure there's other ways that people who are, and I feel like there's a lot of people getting certified as journey work, and what do you call it? An NTO guide, right? Where it's like they can get a hold of a lot of different substances.
Right.
So that's where I'm trying to make it clear of like what is the line of like, this is the legal way of doing it. And then, other people are doing it under the umbrella of it's not criminalized.
Right. It's a little bit of the Wild West. You know what I mean? Another thing that I really liked about Prati is that they required anyone to be part of their training to already be licensed in some medical or therapeutic field. So whether it's nurse or doctor or LCSW or MFT or music therapy or some type of licensed individual where there's already some education and training toward that, then there are other training programs which are also great. There isn't really a certification process because this has kind of materialized after this medicine is legal. So like if and when MDMA becomes available and legal, my guess is that it will be introduced with you have to have this training and this certification in order to use it in this very specific way, because it will become legal at the same time that people are trying to advertise it or use it in an above board way. Yeah. Does that make sense?
Yeah.
I want to say, the majority of the research on ketamine therapy is an IV infusion model. And so that's very different. There's no therapeutic intervention whatsoever in that model. Folks come into almost like a chemo center or an infusion center and are hooked up to an IV for 40 minutes. It's about half the dosage of what we use. It's a 0.5 milligram per kilogram. Our baseline is 1 milligram per kilogram, and it's administered slowly over 40 to 50 minutes. So there's not really attention paid to like set or setting. There's no intention setting. There's no intervention afterwards.
What is that called?
IV infusion.
So that's ketamine IV infusion, and there are places that offer that. And so, yeah, that's actually really interesting because I've seen that, and explain the difference between, and I think you're actually doing that, explain the difference between that and why someone would do that, and then the container you built, which that was one of the reasons I want to have you on, is I really loved the container. So talk a little bit about that.
Okay. So the IV infusion, I think there's a few reasons that it's kind of more available. So like I was saying that's the majority of the research that's been done. But it's more also clinical. It's more clinical. So it's only utilizing the biochemical effect of this medicine, which is remarkable in and of itself. the majority of the research is done with acutely depressed, actively suicidal. That's the demographic. Those clinical trial participants are going in for 6 IV infusions over 2 weeks. So they're getting extremely intensive treatment, and they're only measuring the biochemical effect of the medicine. No therapy, oftentimes no music, no integration afterwards. And so what, understandably so for, research and insurance purposes and so forth, it's like, what does this medicine actually do? Is it reliable? Is it replicable? And so forth, with eliminating the other variables that might affect the success of it. And it's like 80-something% successful.
And suicidal.
On the suicidal scale. Absolutely. For that demographic.
Saving people for sure.
Right. From a business perspective, and this is where it's kind of gotten dicey, I think, in our culture, that it's become this kind of revolving door, multiple, if there's a ketamine clinic, there's often many rooms that a client can be situated, get their IV. Often there isn't a medical professional in the room with them. There's certainly not a therapist in the room with them. There might be one medical professional kind of monitoring many rooms at any given time. And so it's kind of become this profitable money-making framework. So it's often more affordable than the way that we do it, which is myself and the doctor that I work with are present with every individual client for the entirety of their session. And so the time that it takes to pay 2 professionals, it's an entirely different approach. We're also doing what is traditionally called intention setting, but I've kind of moved away from that language for the reasons that we talked about earlier around we're using the parts of our brain that we have access to in this moment to create these intentions. And then we're trying to kind of superimpose them on this whole other psychedelic galaxy.
Yeah.
You know what I mean? And they often, if we're too attached to our intentions, I think that we can miss what's there for us.
Yeah, like leaving it more open, going into it more open and just letting the medicine tell you what it needs to tell you.
Show me what I need to see is often the mantra that I use. Yeah. So during my preparation sessions, we are definitely being intentional and mindful and conscious about entering the psychedelic space. But what I'm often doing is kind of focusing on expectation management, maybe loosen the intention a little bit, be open and curious about other things that could be there for you.
Yeah.
And so that framework kind of speaks to what we are doing that something like an IV clinic is not doing.
Yeah.
And then there's also another way that it's used at a psycholytic dose, which is lower than a psychedelic dose. And that's often a nasal spray or a lozenge. And in that framework, a doctor is prescribing the client the medicine. The client goes to the pharmacy and gets it. The client has it in their possession and uses it in a therapist's office. And the dose is low enough that they remain available to engage in therapy during the session while they're using the medicine. The psychedelic dose at which we are using is the peak point of the dissociation. So it's not engaged. We're not engaging in therapy during the actual medicine. We dig into the journey afterwards through the integration process. So at this lower dose, it is a softening of the psyche. It's a softening of the ego. It allows people to remain available to engage in therapy while they're using the medicine.
Okay. And so how many sessions are there, and which one is the ketamine therapy session as you set up your container?
So the medicine sessions, anyone who contacts us would do a free consultation with me. And that's kind of the beginning of the assessment process where you might start talking about what's alive for you, what's happening, and how many medicine sessions we're deciding together along with the doctor who enters the picture later, but we kind of start talking about how many medicine sessions might be helpful. And 95% of the folks that we see start with a 3 medicine session treatment arc. And so just taking that as an example, we would start everyone with a medical intake which is an appointment, a 1-hour appointment with the client and myself and the doctor. And that's followed by at least, well, and let me say about that, this person becomes our patient for this treatment arc. And so we need to have a file on them. We may be audited, at some point. And so it's like, just like a family practice doctor would, have an intake with a new patient. That's similar to what we're talking about, except we're looking at medical facts. We're also looking at psychosocial history. We're looking at what's your experience been like with psychedelics. And so it's kind of this biopsychosocial medical intake. And that session is followed by a preparation session just with myself and the client. That's also a 1-hour session. And sometimes folks feel like they need more than one prep session. And so we can always add to that, but one is required. And then the medicine session, both the doctor's name is Dr. Prentice Steffen. Both he and I are present for the entire 3 hours of the medicine session. And that's where...
So it's a 3-hour...
It's a 3-hour medicine session. So clients come in, we do, a check-in. We've already met with them a few times by this point. Prentice takes the vitals at the beginning and at the end of the session, the process of the sublingual for the 12 minutes, and then the intramuscular doses are given. And the peak part of that dissociation is typically about an hour. That kind of you're uncoupled from your body, from this kind of plane, this earthly plane. And then there's the tail of the journey, which is when people are kind of drifting back into their bodies. I call it re-inhabiting their bodies. And there is still a lot of, juicy therapeutic benefit there. It's not the peak part of that dissociation any longer, but it is kind of a drifty, dreamy time to kind of come back into the body. And then people are welcome to talk about their experience if they'd like to, as they're coming out. For me personally, I use this medicine probably 3 to 4 times a year. And it's such a relief and a respite to have my brain turned off and to not have all the chatter and the racing thoughts. And like I often say, it's like 27 windows open on my laptop. They just all get clicked down and closed. And so I am not in a rush to start talking about my journeys as I'm coming out. I really want to hold on to that just like spaciousness and quiet that happens in my brain. I often describe it as a reset. And so Prentice and I are both there, and people can start to talk about their journey if they'd like to, but they absolutely don't have to.
And so what does it feel like as the medicine, for those who may or may not have done psychedelics before? What does it feel like? What is it like? Can you compare it to acid? Can you compare it to mushrooms? No. Okay.
That's the thing.
Do you see anything?
Yes, there are often visuals. It's not a hallucinogen. And so it's not as if I opened my eyes and looked around the room that there would be colors, or your vision, I suppose, would be distorted. But because it is an anesthetic, it's a sedative. Most often eyeballs can't focus and
it's better to have so your eyes are closed. You have a mask on while you're doing it.
Yep, mask on, headphones. There we use a number of curated playlists, most of which were developed by Prati. That matches the specific trajectory of an intramuscular ketamine journey.
Is it like Hertz? Like special Hertz music?
Oh, it can be. Actually, we just had a client for the first time we introduced binaural beats. Because all of the playlists were just too active for him. They were kind of agitating for him. And so we just put on super mellow binaural beats, and he liked that. But typically they are tracks that you might hear similar to you might hear at a spa or in a yoga class or something. No lyrics ever, no human voices. We don't want your brain to be able to associate the music with any other experience. Or I heard this song at my 8th grade graduation, or whatever, the brain does when it associates.
I have a funniest story real quick. Okay. So I went and just to music, the importance of music and having it be right for whatever journey you're on. I did this holotropic, I don't know if I'm saying it right. Holotropic. And they had us on our back hyperventilating, and then they come and do the toning, right, where they grab your hands and then you're supposed to go like, ooh. And when the guy came over to me to grab onto me to do the toning. The song from The Lion King started playing, and it was like, oh, and I was like, I can't do this right now.
Wait.
Yeah, but I think we can't be playing Disney songs when I'm breathing. Yeah. Anyways, it just reminded me. I was like, yeah, I totally get the music. And if it's not right, you're like, yeah, I can't do Lion King right now.
It's so important.
Yeah.
It's so important.
Yeah. And I remember my brain, I just totally came out of it. And I'm like, oh my gosh, I need to pick another song. But we were in a group of people and I couldn't dictate. But anyways, to the music.
Yeah.
Okay. So is the person, when they go into the journey and they start to fully be taken over by the medicine, are they talking to you?
Typically not. Typically not. Some people do speak, but it's not in an engaged way.
So it's a very internal process. And so things come up, but you're not like needing to vocalize them. I remember when I did the MDMA, I had my mask on and I kept on telling my journey sitter, like, write that down. Because I didn't want to forget anything. I'm like, write that down.
Right.
So it's not like that.
It's not like that because you don't realize that you have a body. You are in another galaxy.
Yeah.
It's delightful.
Yeah.
It's delightful. And it's not really comparable to any other psychedelic that I've used that often are kind of this like more becoming or more embodied, you know? And actually that was one of the first things that I thought when I started learning about ketamine, like everything else I do in my life, I think, is to become more embodied.
Yeah.
And now here we are kind of yanking people out of their bodies, but it is super gentle. And it is this relief feeling. It can be this relief feeling. In the beginning, it can also feel scary.
As I was going to ask, my next question was, do people ever get scared or feel out of control?
Sure. Absolutely. The dissociative piece of this is I can just feel the fear. It's not like all the alarms are.
Well, that's interesting because fear came up for you. So was your first journey fearful? Do you feel like maybe the medicine made you feel fearful?
Well, my first journey was the absence of fear.
Oh, the absence of fear. Okay.
Yeah.
That's right.
But it can be scary as you're kind of, anything intramuscular, it's entering your bloodstream pretty quickly. It can be pretty abrupt, which is part of why we do the sublingual dose. There's already some medicine kind of in the system. And so it's not such an abrupt takeoff. But even with the sublingual dose, it can feel very fast. And we talk about this in the preparation session, and just to let go and to know that you're going to be fine. People often describe it as kind of like inching up the roller coaster. And once you're over that and you're gone, then people are typically fine. But even when it is scary, I call it's just like you just get to experience that feeling. It's not like it's scary, so let's do something about it. It's scary, so my body is going to respond as such. It's just like, it's just content. It's just material.
Yeah.
And that's why it's so effective with trauma, because even if traumatic content and material does come up, the body doesn't respond to the trauma, which is what PTSD is, right? Like if we have a flashback, if we have a nightmare, if there's a trigger, my eyes might pupillate, my pupils might dilate. Whoa, just mixed up my syllables there.
It's a new word, pupillate. I like
pupillate. You heard it here first. But it's like my temperature might change. My breathing might change. These are all the like responses to the trigger. Does that make sense? And so without those material, and here's back to where the energy can just move through in a different kind of way. If the body responds and contracts, this is where the energy just gets trapped. And it's kind of on this merry-go-round, and we just go around and around. When the body doesn't respond as such, this channel is able to just open and things can just move up and out in a very different kind of way. It's like the body can metabolize it in a different kind of way.
Yeah. And so the journey happens, the person comes out of the journey and then goes home, and then they come back for integration. Talk a little bit about that.
Right. So I do want to say they have to have a ride home. Like people are in no shape to drive after this journey. And I really encourage them to take it super easy for the rest of the day after the medicine. So then integration, which is typically the next day, sometimes because of schedules or some other things, we do it in 2 days. But it is, the psychedelic experience is often so cool, and people want to talk about that, and that's great. And I want to hear about it. And often there is kind of symbolism in what people see, and sometimes there isn't. It seems totally random. Yeah. Yeah. So there doesn't seem to be any like because I had symbolism, it worked better. Do you know what I mean? The biochemical effect, like that folks are getting in the IV infusion, is the same, regardless of if there's a psychedelic experience or not. And in fact, in the IV infusion, people often are not having a psychedelic experience because they're receiving less medicine and they're receiving it over a longer period of time. Our clients are receiving a larger dose of medicine all at once. And so that's what kind of creates the psychedelic experience. And like I said before, the IV infusion is incredibly effective.
Yeah.
So, so people often want to talk about the psychedelic experience. And also what happens then, part of the biochemical effect is that all the billions of neurons that are floating around in our brain have these dendrites, and they're like the little bridges that pop out and connect our neurons to each other. And that is what ketamine is spurring the growth of. That is the new neural network. That's the new neural pathway.
Literally building new neural pathways in the journey. That's super cool.
Right. And so I often, through the integration process, I'm telling people, you don't wake up from this journey and have all the insight you're ever going to get. It's like, I often will say, like, it's like you have all these new hiking trails in your brain and you don't know where they go until you have the days and weeks to go out and take the hiking trails.
Yeah.
Right. And so I often myself will find myself making a different kind of decision, having a different kind of behavior, having a different kind of reaction or response to something.
Yeah.
It's effortless. It just happens.
Wow.
And then I'll
look back. You don't have to do very focused programmatic integration. Like, things just change.
Things can just change, and integration is also important because if we just slam ourselves back into how we were living before, these new neural pathways will grow over. If we don't, like a hiking trail will grow over unless we're taking them. So it's a lot about noticing. It's a lot about
being purposeful. It's not going to do the work for you, but it's going to make it a lot easier.
Exactly.
Yeah.
And making changes that support that, right? And so what are the ways that I can stay connected to the feeling? Because I often do feel a reset. I often do feel like I just worked with a client this afternoon who said, this feels like a heart opener, feels like an empathogen, which it typically is not. Not like MDMA is a heart opener and an empathogen, but what it does do is kind of clear out the clutter in there, and it kind of lets people be the truest version of themselves, which is often empathetic.
Yeah.
Right. And so it's not like it's providing you with this empathy. It's removing all these barriers to who you truly are at your essence.
Yeah.
Which is often an empathetic person that has more compassion and connection available than our kind of fast-paced society allows us to have.
And all the trauma takes that away from you because you have your guard up and you're trying to protect yourself. So where you might have been empathetic, all these things happen to you, and then you're so guarded and trying to be like, I can't take anymore. Right. So that's beautiful. I love that.
So how do you create opportunities to remain in this empathy bubble, right?
Yeah,
instead of
test
just
it out.
Yes, like go back to work or go back to parenting or go back to whatever your life is without taking time for yourself, without connecting with nature, without connecting with breath, with movement, and so the integration is often the usual suspects,
Yeah.
But occasionally there will be something totally new and unexpected. Like I had a client discover that she loved doing pottery during her integration. Like that's the time that she goes, and when she's working with her hands and really being creative, that she feels the most connected to how she felt during the journey. Yeah. So like occasionally something cool and exciting will happen like that too.
Yeah.
Something brand new.
So what examples are you able to say under patient confidentiality? Obviously you can't say anybody's names. What are some examples, if you can share, of like this person came in with this and then they were able to fix this type of situation or this type of issue, or fixing probably isn't the right word, but, live better in spite of these things that were making them sad or keeping them stuck?
Yeah. Yeah. It feels like, and it feels like for me, and it sounds like for my clients, that there's just space between me and who I am and whatever this thing is. It's not this like encompassing, like I am depressed, I am anxious, I have trauma. You know, it's like I had a client describe it as like there's a pane of glass between her and her anxiety. Or people say it feels like I have room to breathe a little bit more than I did before. I had a patient say he felt like he was more able to like pause and respond to his kids rather than just react. Yeah, I mean, it just feels like this spaciousness around where there's more agency, that like this life and these diagnoses aren't happening to me. They're not who I am. They're these things around me that I still need to work with. They're still there. You know, it's not a magic pill, but there's a little bit of space where I can work with it some more. I had a UCSC client who was really, really struggling with social anxiety. And of course, that was impacting his studies and his ability to be on campus and have roommates and all the things. And he just said, I feel like I like myself. And it just changed his whole, how he interacted with everything around him. And like, how do we measure that or replicate it? Here's the other thing about, you know, when the FDA or whomever are you know, considering these clinical trials and legalizing things and having them being coverable by insurance, they want it to be measurable and replicable. And typically no two journeys are the same. You know, it's really interesting dichotomy of wanting it to be accessible and of course wanting insurance to cover it and all the things. But in order to do so, it's like you give this person this dose on different days and you get the same result. And that's not how psychedelic medicine works. You know,
Does insurance cover it?
There are some insurances that will cover some IV infusion, not very much. I've heard Medicare under certain instances can. Some types of, we sometimes will write a super bill, which is like there are some insurances that give people kind of discretionary funds, or actually the person has to spend their own money, but may be reimbursed for it. And I don't know what the criteria is, how they decide that, but it's largely not covered, mostly not covered.
Yeah. And if someone does have like a bad trip, like what does that look like?
Yeah. So very, very infrequent with ketamine. But we have had probably 4 or 5 people who have, from the outside, looked or sounded distressed, crying, wailing, some more movement than what people normally do. And what I can say about every single one of those people is that they've come back for more treatment. And so they have come out of their journey and said either immediately, sometimes it's immediate. That was the energy that was stuck that needed to move. That is what was trapped inside my body that I was wrestling with over and over and couldn't get past. And even though it was challenging or distressing, the experience, it was the freedom that they needed from that energy being trapped.
But it wasn't necessarily out of control. Like it's, there might be more movement, but it's not like they're running around, ripping off all their clothes and like losing their mind.
No, you wouldn't be able to kind of get up and run around at the dose that we're using. People can move and speak, but I mean, maybe I shouldn't say you never would be able to, but no one that we've ever worked with. Yeah.
I don't know why that's the first thing came to mind. Like, I'm going to like rip off all your clothes and run around.
Right.
Because I guess that would make me nervous, but maybe not really. I don't know.
I mean, it's tricky, right? Like with other medicines, I'm like, do your thing. If that's what needs to happen, there's no shame, right? Like we've talked about this too, where it's like taking our clothes off is the worst thing that could happen. It's just a whole other ball of wax. But in any event, nothing like that has ever happened. And like I say, all the people have said, like, there's so much freedom on the other side of this bad trip, right? Which it's really tricky when people come in and talk about a bad trip or a K-hole. Like, what are these kind of negative?
Yeah, I've heard that.
So that typically happens when people are using ketamine recreationally, which is often a powder that's snorted, that's not measured.
Probably not clean.
Who knows? And because it has such a short half-life, it's in and out of the system so quickly, people are often using it multiple times throughout an event, an evening, whatever, and they reach that point of dissociation accidentally at a party, at a concert, at a festival. And so they are dissociated from their body, and outwardly you can see like that as someone in a K-hole. And so if they're having that energy move, I mean, that in and of itself can be pretty alarming if you don't know what's going on.
Yeah.
Both as the person who's experiencing it and as the people around them.
Yeah.
If there is this energy that moves where it is scary or looks distressing, or the person is crying or wailing or yelling, that can be, again, that stuck energy that's just moving out in a different kind of way, unplanned.
Yeah.
Not considering set and setting, not considering who's around me. Are they safe? Do I trust them? Is my body safe? Not intentionally going into this process going, okay, I'm going to be gone from my body for a while, but I am going to come back. Yeah. And I know that I'm safe.
So you really feel completely disassociated from your body. So do you look and see your body and be like, no, you're just like, I'm not in my body.
It's like this consciousness that happens. You're not asleep. There is an experience happening, but you just are, it's so hard to explain. You should come in. I'm just saying.
Try it.
Mm-hmm. It's really beyond explanation. It's not like anything else I've ever experienced.
Who should not do it? Who is it not for?
So good question. Contraindications: unmanaged hypertension, unmanaged high blood pressure. Folks who are having acute manic episodes, folks who have had personal experience, like diagnosed as schizophrenic or schizoaffective, that can sometimes exacerbate that condition. So these are things that we're talking about in the medical intake and in the assessment leading up to the journey. So we want to make sure that, we don't get ourselves in a situation where we don't have some information that we need for the patient's safety.
So that's it, pretty much. Everyone else, it's
it's super safe. We give it to mothers in labor. We give it to nursing mothers.
Ketamine?
It has a very
help them relax.
For pain.
Oh, for pain. Okay, so it's usually a pain. Yeah, that makes sense because of how they were giving it in Vietnam. So I want to make sure I've covered all of like the FAQs that someone might ask. What are some of the questions that I might have missed that people ask you?
Good question. I get a lot of people who understandably so, because they're struggling and suffering so much, is like, will this fix me? And that's another kind of cornerstone of our Western medical system, is like, I'm broken and I need to be fixed. When my personal approach is typically, I'm going to say, 90% of the folks that I've seen, what you're experiencing they're totally reasonable and rational reactions given what you've experienced. It's not like the experience and the reaction are unmatched or are not correlated, or they don't make sense together, So we're in this very like diagnosis treatment driven culture. And we're talking a lot about like, it makes a lot of sense why you might be experiencing that.
A little validating. And I'd love to hear explaining how it creates space, because that's what like most of us need. It's like we have something that's happened and it takes up so much space in our body and our mind. And then anything that can just like create a little bit of extra space and it doesn't feel like it's like your whole being.
Yes.
That really resonated with me when you said that. And just validating. A lot of us just need some validation.
Right.
Like, I wonder if you feel like that.
Totally. We're using this as a tool in the toolbox. It's not a cure for anything,
Yeah.
And one of the reasons that we named our practice Innate is because that we believe that people have the inherent intelligence of their bodies.
Yeah.
That anything that happens during your journey, any insight, any download that you get, it's yours. You already had it.
Yeah.
Right? It's not us. We're not the experts in the room treating you, telling you what you need to do, telling this is your prescription. It's a collaboration, certainly. But I really want to move towards this idea of like, we have the knowledge that we need, but nothing in our culture is really telling us that.
Yeah.
It's always like, go see this expert, go take this pill, go get these shots, look like this, behave like this, have a marriage like this, and like all these external things. And so I really want to move away from that and into like, I have what I need. Like, how do I get access to it?
It's opening up your awareness. to all the answers. I love that. And so how much does it cost? And again, just kind of remind me how many sessions are there? And then a couple things actually you can talk about. I'm curious like what a container looks like and how many sessions, including the journey session, how much relatively it's cost. And then also what other modalities do you bring in? Because I do think that you bring in like breath work and other things. So maybe talk to us a little bit about that.
Yep. So all of our services in this practice and in my coaching practice are available on a sliding scale. So I really want to make this as accessible as possible because I don't believe in like healing for the wealthy and healing for the elite or whatever. So we have a sliding scale that is essentially broken down into $100 an hour, $150 or $200 an hour per person. So it gets tricky because when there's two professionals in the room, we're both getting paid. So for the three medicine session treatment arc I talked about earlier, like at the low end of our sliding scale, that whole treatment arc, which is intake, prep, 3 medicine sessions and 3 integration sessions.
And that would be in a row, like 3 sessions in a row?
So that's a good question. So we typically do 1 medicine session per week, and we do those in consecutive weeks because it does open up this window of neuroplasticity, which is typically 7 to 10 days. And so we really want to get in there and kind of capitalize on the momentum. Having said that, people sometimes say, it feels like too soon to do another medicine. Like I'm still working with the material from the last one. So it's not harmful to spread them out more. And we will often do that maybe 2 weeks apart or once a month. It just kind of depends. So it's not, again, it's the opposite of like, here's the prescription for everyone.
Yeah.
It's not a cookie cutter. It's a collaboration.
Yeah.
So, but for that 3 medicine session treatment arc, the low end is 2,400, the mid is 36, and the high is 48.
Okay. That's good to know, just general pricing, you know, whether it's like 5,000, 10,000, 15,000.
Totally.
So that's helpful.
Yeah. I do want to say we have been getting groups going, which really decreases the cost a lot for clients. And it creates a group field, which actually can be super therapeutically beneficial.
Yeah.
And so we have one coming up in October. It's not full yet. We do 4 people at a time. And there's an individual medical intake just for privacy and confidentiality and so forth. So that would be one-on-one with the doctor. But then the prep session is group. All the medicine sessions are group and the integrations are group. And that is what it breaks down to be is $1,800 for all of that. So it's like 20% lower than the low end of our sliding scale.
Wow. And then the integration is like a group therapy session. Okay. And you were saying that the medicine itself is very internal. So if everyone's together, then they're all kind of doing their own thing.
Yep. Anyway. Everyone's got the eye mask on and the headphones. Occasionally there's talking and movement, but not enough. Like I remember journeying next to a man one time, and that group didn't have the technology for all the headphones. So we just had a speaker on and he was like yelling and screaming, and I had no idea about it until he talked about it afterwards.
Oh, okay.
So that's like the level of dissociation that we're talking about. Yeah. But we do have the capacity for the headphones and eye mask and everything like that. Yeah. So, and even if you are aware of other folks, like in group settings, like ayahuasca, or, you know, it's like just kind of part of the experience that you're aware of the other folks in your field.
Yeah. Interesting. And so talk a little bit about the other modalities you bring into the containers too.
Right. Yeah. So, I mean, almost always I'm talking about like connect back with breath. Like your breath will be there for you, you know? There is a therapy model called internal family systems, which is really beautifully complementary to psychedelic medicine in general, but I would say particularly with ketamine, and it's parts work. So the idea is that we are all comprised of all these different parts that were developed at different points in our lives to keep us safe and so that we could survive that moment. And typically what happens when we're out of balance is that like one part comes up and is super loud and is kind of stuck in overdrive. And the other parts aren't able to come in. The compassionate part isn't able to come in because the angry part is there and really needs to be heard, right? Speaking to your journey from before, or my, like the protector that is the fear that's interwoven in my life to keep me safe from things like that. You know, that was the role of the fear in my life. Like what happens if I fail? Like when I started to unpack the fear, right? It was like, what happens if I fail? What happens if I get embarrassed? What happens if I disappoint someone, right? Like, so the fear was acting as a protector to keep those things from happening. But the deal was it was stuck in overdrive. And so it was impacting all my decisions without me even knowing, because it was so woven in to my programming.
Yeah.
So what happens is that those parts get to rest and get back in balance, right? Like that's the internal family system model. It's comprised of exiles, protectors or managers, and firefighters. And so really interesting model that can be used all on its own, but is really complementary with psychedelic medicine, because that's kind of what's happening anyway. That those, it all takes place in the executive functioning part of our brain, where those parts get really loud and unruly. And it just turns those parts of our brains down. And so the parts can kind of get back into balance, and other voices can be heard and step up, and
creating that space again.
Exactly.
So that all of you can exist more equally.
Right. So I bring that in. I'm not certified in internal family systems, but that's definitely something that we talk about a lot in our sessions. You know, I'm a dancer. I grew up a dancer. And so anytime that I can incorporate movement, or like, where are you holding that? Like, even when you were introducing me and you said breath, I was like, oh, it like just reminded me, like just bring it into the room. Yeah. Like our bodies will take care of it, you know? So, creativity, breath, movement, being outside, getting connected with nature, different therapy models. It's kind of like it's a collaboration of all those things.
Yeah. I love that. And so what would you say is like one of your favorite success stories of someone that you've worked with, where you've like, this is the case study for why I love this medicine?
Yeah. I mean, the UCSC student who said that he liked himself was like pretty outstanding.
The mom is enough.
I know. Oh my gosh. Well, and he happens to be the same age as my son. And so I'm sure there's a lot of overlap there, but like just all these things that he had been wanting to do as a student on campus, and his social anxiety wouldn't allow him to. So he was like going to these events, and he was doing some gaming thing that I don't totally understand, but like he had been wanting to do these things and he couldn't. And so through our integration process, he was able to report to me like all of these events and things that he was doing that he wasn't able to do before. He's also someone who we see for maintenance about every 6 months. And so that's something else I want to bring forward, is that, you know, this isn't, neuroplasticity is not forever. New neural pathways are not forever. And so if, 6, 8, 12 months down the line, it feels like I'm getting back into these deep grooves, like these neural pathways that have very deep grooves.
If something is ingrained from childhood, it's a slippery slope, I would assume. And so just like any kind of muscle work or anything that you want to be good at, you got to practice it and make, and it's and many years as it took to groove those other patterns, you have to put just as much work to groove new patterns.
Right. Yeah. And so now being in, having our practice for about 3 years, almost 3 years, we're starting to see people come back and say, can I do another, 2 or 3 sessions, or just come back for some maintenance. Yeah. So he's someone that we have seen a number of times.
And there's no side effects, right?
I mean, there are side effects with any medicines. I do want to say, like, we have a very thorough informed consent document that's actually found on our website. You don't have to be a client in order to have access to that. So I'm happy to give that web address so that people can check out both our informed consent, and there's really good resources in terms of like research articles on our website that I tried to choose that were like accessible, that I don't have to look at a medical dictionary to understand the language in. Like, I want to be able to read this and understand it, as a non-medical person. So all of the potential side effects that we could find are in our informed consent document, and that's emailed well before the medical intake, so people have a chance to read it, ask questions before they're signing the informed consent document at the first session.
And what are some of them?
They can increase heart rates. They can increase blood pressure. Sometimes it can affect sleep. none of them are long standing. They're typically like in the days following the journey. This bladder irritation can be more associated with recreational regular use, not at the dose that we're using, which is like this short measured treatment arc, but like ongoing, it can create bladder issues. What else? Some people, we have had a handful of people who have just had a bad reaction to it, where they just, they feel hungover. So they have the journey. It's helpful. It's insightful. They get what they need. But then in the days following, they report feeling hungover.
Yeah.
Nausea, sometimes.
It's a drug. Right.
Right. It's a chemical.
Yeah. It's a chemical.
Yeah. It's a pharmaceutical.
Okay. So not too bad.
For folks who are prone to motion sickness, that's part of our medical intake, and we do pre-treat with Zofran for nausea. There's almost always movement associated with the journey. And so if people are predisposed to nausea, we'll pre-treat for nausea.
Okay. That's really helpful. So really nothing too bad, but not going to like lose your eyesight or grow a horn or anything.
Super safe. It's really, really safe. Yeah.
And so it doesn't seem super, super mainstream. Like, what do you think is holding it back? Do you think it's like big pharma?
Well, ketamine is big pharma. Well, okay. So there's a few different things. One is that I think if we're going a little like, what are those called when they're like controversial theories?
Yes, I know. I can't think of the word, but
it'll come to us when we stop thinking about it.
Yeah.
If you do something once a year or maybe twice a year and it helps you feel better, a pharma company that creates a pill that they want you to take every day forever is not going to be excited about this idea.
Exactly. Conspiracy theory.
Yes. So satisfying.
Oh my gosh, I had to.
Yeah. This idea that I spoke to earlier about like, we have the answers. We need to stop seeking outside for external, tell me what's wrong with me and give me a prescription.
Yeah.
For the businesses that make money off us thinking that there's something wrong with us.
Yeah.
They're not going to be excited about psychedelic medicine.
Yeah.
The thing that I spoke to earlier about it being the same dose and the same person and the same experience. That's not how it works. We don't know what we don't know. We don't know what we're going to discover when we're in there. And I can understand
flexible medicine. Like, God forbid we have flexible medicine for people.
Right. And I understand, like, as an insurance company, for us to say, like, we don't really know what's going to happen, but do you want to give us money anyway? Like, I can understand that they're not super excited about that idea. But I have, like, full 100% faith that, like, the medicine gives us what we need.
Yeah.
It's not a very usual Western medicine kind of approach.
Well, I love it. I'm all about alternative therapies because
we're in the right place.
My background is having a mom that was hooked on prescription pills that eventually passed away. And so I'm like, anything that is not a day to day, that's not going to make you want to kill yourself when you stop taking it and try to get off of it. Like, let's just normalize that first of all. So I'm very interested in these types of things, especially for mental health, because it's something I'm really passionate about.
Right.
How old do you have to be?
So our youngest client was 15 or 16 when we started seeing her, pretty severe depression. I think our oldest client was in their 80s, maybe. Again, because of the safety profile, there aren't a lot of people that this isn't helpful for. If someone is a little older, we actually had a client who was terminally ill, who was dealing with kind of like end of life existential.
I'm just going to ask about that.
So Prati has just started developing an end of life training. I mean, they're not developing it; they're already doing it. I have some good friends who I used to work with at hospice who went.
Yeah.
So even medically fragile people who are terminally ill, it's safe for them.
Yeah.
And she was, talk about success story. I mean, she was having on every kind of medication you can imagine, treating all these different, comorbidities that she had. And she said she was just able to like be separate from her body. Like she had become her illness.
Yeah.
And during this, she got to be uncoupled from her body and like not be consumed by all these diseases that were.
Remember what it felt like just to be in her body and not feel all that. Oh, that's so beautiful.
Yeah.
I'm so happy for this conversation, and I really hope that it reaches the right people and they get this in their brain to consider, before things get too bad.
Right.
And also before they get hooked on medication that is just dealing with symptoms, because this really feels like it gets to the root.
Right.
And that's what we want. We want to get to the root. We want to get to the root cause. We want to work on programming. And there's different ways, right? Some people do hypnotherapy. Some people go to talk therapy. But this is like so awesome. And you guys make it affordable too. You guys sliding scale. You make it,
We can, yeah. It's still a lot of money, And so I've worked with clients. Most of the time we're having people just pay by week because people get sick or kids get sick, or sometimes people have 3 sessions scheduled and they say, after 2, I feel complete. I feel like I got what I need. So we don't ask for the money all up front. Typically we go week by week. As services are provided, people are paying for them. But I've also worked with clients on sliding payment plans. Yeah. So the total cost broken up over by month instead of by week or whatever. Like we're going to do whatever we can to make it work for people.
Right. I mean, I'm paying out of pocket for therapy for people in my family, $180 an hour.
Right.
So comparatively, when you're really looking at trying to like up level your life and really work through something, so many people are struggling. So I love what you're doing so much.
And I do hope the group thing takes off a little more too, because that does make it
even more
affordable.
And that's what I was thinking for the, the 1800, the group,
yes.
That does seem that it is, it is still a lot of money for people, but it's when I think about all the other things that you can pay for and try,
right.
It seems relatively affordable. So, have I missed anything? I think I really grilled you on almost everything I could think of, unless you feel like there's something else that you hear from your patients and clients that would be helpful for anybody listening.
I think that I want to say that someone doesn't have to have like a diagnosis. You don't have to be like have treatment-resistant depression or anxiety or have been diagnosed with PTSD to come in. We have worked with people who are just like this like general malaise. Like I have all the ingredients to have a happy life and I'm just like not stoked. We worked with a retired doctor who said, I lost my mojo. Like what? I'm not, So the flip side, the good side of insurance not covering this service is that we don't have to diagnose you. You don't have to have a measurable, tangible, like you are this. As a therapist, I would have to write notes and diagnose and send into an insurance company in order for them to cover it. So of course there's an assessment done. Of course we're very careful and safe about it all, but I don't think that there's anybody who couldn't benefit from it. Even just like a psycho-spiritual exploration, like an existential kind of exploration.
Stuck.
Yes. Stuck is the number one word that we hear. Yeah. I'm doing all the things. I go to yoga, I do my breath work, I eat well, I'm doing all the things, and I'm just stuck.
Yeah.
And Scott Shannon is the lead psychiatrist at Prati, and he writes beautifully and talks about people just getting unstuck.
Yeah. I love that. So how can people find you? Tell us about all the ways that people can find you and contact you and learn more.
Okay. This is the part that feels funny. So our website is, I forgot we were here. Hi. Hello. Our website is innatesantacruz.com, INNATE santacruz.com. My email is amanda@innatesantacruz.com. Those are the best ways that you can find us. And like I said, there is a resources and documents page on our website where there's tons of information. We were also interviewed, both Prentice and I, by a company, an organization called Psychedelic Support several years ago. So there is kind of a blog interview on there that has a lot of the information that we talked about today, but there's a link to that. The current group dates are on the site. I also write a newsletter on the Sabbats of the Wheel of the Year, and the link to all of those newsletters are on the website. So there's tons of good information there.
And I'll put all the details in the show notes at the bottom of this on the platform where everybody's listening from. Thank you so much.
Thank you so much.
Awesome. I know I wanna try for sure. I'm really interested in it. And if you're out there, check out Amanda and Innate. And in happiness and health, everybody. Talk to you soon. Thank you for listening to Humanize the Hustle podcast. If you would like to get in touch with the show, email me at myalchemylife@gmail.com or follow me on Instagram at Wellness with Alicia. And if you like the show, please share it with someone you love and make sure and give us a 5-star review. Talk to you next time, and remember, health and happiness is non-negotiable.